Uranotest dermatophytes is a culture medium designed for the diagnosis of dermatophytosis in an easy, quick and reliable manner. Unlike the traditional tube media, this test uses a 5 cm diameter plate that allows for much simpler seeding. The procedure is very simple. The protective aluminium film is removed and the sample of hair or flakes obtained from the suspicious area is deposited on the culture medium, ensuring good contact with the surface, but without burying the sample in the medium. Once the seeding has been performed, the plate is incubated at room temperature, preferably in the dark. It is very important to always keep the plate with the cap upside down. If a culture oven is used for the incubation, the temperature must be programmed to between 27 and 28 degrees. From day 2, observe the plate every day in order to determine whether the medium has changed to a red colour, and to see if white colour colonies with a powdery or velvety appearance have grown. The growth and change in the medium may take place at any time between days 2 and 12. Those samples which do not exhibit a change in colour or growth of white colonies during this period are considered to be negative. The growth of black, brown or grey-brown colonies is caused by saprophytic flora. Although obtaining a positive result is enough to allow for the prescription of a suitable treatment, the dermatophyte's plate has been designed to facilitate the collection of colonies by means of an adhesive tape, for subsequent observation under the microscope in order to identify the species involved. When the colony is 10 to 12 days old, the transparent adhesive tape is placed over the colonies by pressing slightly. The sample is transferred to a slide, to which a drop of the contrast solution supplied with the kit has been previously added. The adhesive tape acts as a slide cover. The macroconidia may be observed under the microscope and identified by performing a differential diagnosis between the different species. For a good culture, it's very important to correctly take the samples from the suspicious area. Washing the skin is only recommended in the case of great contamination and the presence of scabs. If washing is carried out, non-medicated soap without antifungal properties must always be used, and the skin must be well dried prior to taking the sample. With the aid of scalpel or tweezers, select the hair and/or flakes. Preferably select hair and flakes primarily from the periphery of the lesion. The best samples are fragile broken hairs as well as those that exhibit fluorescence under a Wood's lamp. Take only a small amount of hair and flakes, as an excessive amount of samples may induce the growth of saprophytic flora. In the case of asymptomatic cats, it is recommended to take a sample of epithelial flakes from the suspicious area by rubbing with a sterile toothbrush. Once the area has been brushed, the toothbrush bristle ends may be cut and incubated directly on the plate.